Yeah, it's really my pleasure to be part of this fantastic symposium. Thanks for having me. And it's my pleasure to be able to present the Apple Heart Study results on behalf of all the heart study investigators, and in particular the clinical co-principal investigators Mintu Taraki and Marco Perez, who presented these results at the ACC scientific sessions last March. We always have to remember the participants who participate in these trials and the time and effort they made and spent to help us answer important questions. These are my financial disclosures. They can be seen on my Stanford University faculty profile website on the internet. As Roxana mentioned, the Apple Heart Study was coordinated out of Stanford, but it was an academic industry partnership with Apple, who was the sponsor. But all data collection, all analyses and interpretation were done. And the trial was also overseen by a series of common data committees and steering committees, and we had important commercial vendors, Amwell and Biotelemetry. Well, you all know that the optical sensor using PPG technology on your watch can detect pulse waveforms, and that's how you get the heart rate reported back to you on those devices. And obviously, detection of irregular pulse could be useful in the detection of atrial fibrillation in this setting. So the overall goal of the Apple Heart Study was to evaluate the ability of an irregular pulse notification algorithm on the watch to identify atrial fibrillation and potentially guide subsequent clinical evaluation. Importantly, the Apple Heart Study only looked at the optical sensor technology. It did not evaluate the ECG technology that's now available on the newer version of the Apple Watch since late last year. We also wanted to study this not in a small, well-controlled population, but rather in a very large population so we could understand how this technology behaved in society. So how does the algorithm work? The algorithm is a program that runs in the background when the wearer has the watch on and is at rest. And it measures the interval between pulses, and it generates a tachygram. If the pulse interval is regular, it generates a regular tachygram that's stored on the watch. If, however, an irregular interval is noted, an irregular tachygram is produced, as shown in the orange dot, and the program then goes into a more frequent assessment mode. And if 5 out of 6 tachygrams are identified in sequence to be abnormal, a notification is sent to the watch that there is an irregular pulse and possible arrhythmia. The Apple Heart Study was a virtual end-to-end study that included no bricks and mortars, and everything was done through the Apple phone. Patients downloaded an app and provided consent on the phone. If they had 5 out of 6 irregular tachygrams in series, a notification was sent to the watch, and they were instructed to contact a telehealth provider. If there was any acute emergencies, they were referred appropriately. They also had additional screening and eligibility criteria assessed. And if appropriate, they were sent an ECG patch through the mail to wear for 7 days. The results were returned to the participants through the telehealth provider as well. And if the participant desired, we sent a copy of the result to their physician. We also collected in the study and 90-day patient-reported outcomes on surveys through the phone. Here are the primary endpoints. The first was the detection of atrial fibrillation lasting for at least 30 seconds on the ECG patch. We also wanted to evaluate, while the participant was both wearing the watch and had the ECG patch on their chest, the occurrence of simultaneous atrial fibrillation on the ECG patch and if there was a single irregular tachygram. We also wanted to evaluate the occurrence of atrial fibrillation on the E-patch, and if there was a notification sent to the person's watch at the same time. We also were going to analyze the patient-reported outcomes and healthcare utilization. In just 8 months, we enrolled nearly 420,000 participants in all 50 states and the District of Columbia. This represented 1 in every 650 eligible Americans. Importantly, this was not a young, healthy population. The mean age not shown here was 41 in the overall trial, over 50 in those who received a notification. But look at the proportion of participants with a CHA2DS2-VASc score of at least 2. 13 in the overall population, and 30 to 40%. These are participants and patients now who may have a disease that requires some form of intervention. Over 40% of participants were obese. 1 in 5 had hypertension in the overall cohort, and 40% in those that received a notification. The overall proportion of participants that received a notification was very low. And this is important because we didn't want to have an overwhelming burden on society and false positive notifications. As you can see here, out of the 420,000 participants, 2,169, or 0.52%, had a notification. As you would expect, the notification proportion of patients was higher in those at least 65 years of age here, 3.2%, and lower in the younger age groups. And importantly, was only 0.16% in those 22 to 39 years of age. Women had less notifications than men, as shown. What about the yield of atrial fibrillation on the ECG patch? Of the 450 participants who received a patch, wore it, returned it, and it was analyzable, 153, or 34%, had atrial fibrillation on the E-patch. Now, you may wonder that's a little bit small, but remember that atrial fibrillation is a paroxysmal disease, and it took nearly 13 days from the time the notification happened on the watch to the participant receiving the patch and placing it for 6 days. You can see the yield or proportion of, or the percent of patients with atrial fibrillation on the E-patch in the age group categories, a trend to slightly lower yield in the younger patients and in female participants compared to male participants. Here are the data on the positive predictive values, both for the individual irregular tachograms, but also for notifications to the iWatch. Remember, the positive predictive value tells you the likelihood that if there was an irregular tachogram or an irregular notification, while the E-patch was being worn at the same time, the likelihood that atrial fibrillation would be detected. In the overall trial, at the irregular tachogram level, you can see that the positive predictive values ranged from 60 to 71%. More importantly, though, when the watch and the E-patch were being worn simultaneously and a notification of an irregular pulse was provided to the participant by the watch, 84% of the time, atrial fibrillation was detected on the E-patch, and a similar positive predictive value of 78% in those at least 65 years of age. So in conclusion, I believe the Apple Heart study showed what Mike was nicely talking about, that we can have these tremendous operational successes in enrolling large patient populations very quickly 8 months to enroll 420,000 participants. The overall burden of notifications was low. We know that if people wear an e-patch on average 13 days or 2 weeks after they have a notification, that 34% of the time they would have atrial fibrillation on that e-patch. The positive predictive values were 71% at the tachogram level and 84% if the watch provided the participant a notification of an irregular pulse. Although I didn't have time to show you the patient-reported outcome data, 57% of the participants who were notified contacted non-study providers for additional health care, and we found that overall, the exposure to the app was safe. So thank you very much for your time and attention this morning.